As you know, most patients do not like to come to the dentist. They usually call you on a last minute or the same day with an emergency. I had several experiences with that. Of course, last 25, 27 years, hundreds and hundreds. Every day you get about 1 to 2 or 3 calls of that sort of emergency. There are times that the patient is in tears and they are crying. Or they are sitting in the reception room and they're crying. And there are times that I really, if I see it or they inform me that someone is crying in the reception area and they're waiting to be seated, I usually go grab them, bring them in, and numb the tooth immediately. I know it's out of sequence. I don't even introduce myself pretty much. They don't want to know who the heck you are, So I go in there, numb them, and they're so happy that they have no pain. Then you can talk to them. Then they can fill out some of the rest of them, their health history or whatever. I ask them, of course, if they're allergic to anything, but people are in pain. The best thing you can do is get there, get them out of pain. And I had a few of those, and that's the best, exciting time of the day when you can get somebody out of that type of pain and get them relieved and comforted. So long story short is they come in, we'll try to see them the same day. There are a lot of things we can do. There are sometimes you got to put them on antibiotics and pain medicine and so on, but I try to do as much we can that day, because sometimes antibiotics takes 3 to 4 days to work. The reason we used to do antibiotics was to get better numbing effect, because the pus is acidic. It interferes with the numbing medication you give to the patient. So sometimes we do that, but I try to release the incision. I try to get the pus out, get them comfortable, get them to the point that they can get numb and they can get treatment the same day. And of course, there are days you have to wait. But if they don't take care of these or they don't come in, I always tell patients, please don't wait till it becomes an emergency. I try to encourage our routine patients, hey, it's gonna happen. Don't call me on a weekend, right? Call me, come in and fix it before that happens.